One of the difficulties that I found with the 2010 review of Lyme disease, that unfortunately it ignored a lot of facts that are present in Australia, and many of us who have been at the forefront of treating this disorder haven't even been contacted. My experience with Lyme disease started some 17 years ago. Most of the patients I saw were from America, Canada and Europe. Then I realised many of my other patients who presented with what looked like Lyme disease had never left Australia, had evidence of tick bite in Australia, and started to have positive testing here, either initially through a laboratory in Sydney under the control of an infectious diseases specialist, and I was getting positive ELISA, IgG and IgM and Western blot tests. Now this is in 1999 to about 2005. Then something happened in 2005 where we stopped getting tests that were positive through this lab, and I'm not sure why. So I started using PCR testing. Initially this was done in Sydney and in Melbourne, and I had a number of Lyme disease, Borrelia burgdorferi positive PCR testing, and eventually a lot of the tests I started to do were done in Germany and through IGeneX in America, and these too were showing positive with IgG positive and IgM on ELISA. They were having positive Western blots, positive PCR, and even some of the co-infections such as Babesia, Bartonella, Rickettsia were also positive, as well as the Mycoplasma chlamydia pneumoniae. So we've got a whole spectrum of disorders and organisms that in my mind that I've been getting positive tests for a number of years, which I have documented in a study that I'm doing at the moment. But it would seem strange to me that 2010 concluded that Lyme disease was not in Australia. Now I categorically refute that. I think we need more evidence, of course. I'm totally supportive of that. But to say something doesn't exist when there seems to be so many patients presenting with Lyme disease means that we've actually cut off the investigations that need to happen before they've happened. Currently I'm involved with a number of researchers through Sydney University. We're actually looking at patients with what's thought to be Lyme disease, as well as patients who may think they have contracted it, and patients who haven't had Lyme disease. And we're actually doing a number of tests, including ELISA and Western blot and PCR testing, as well as looking as co-infections. What we need in Australia is adequate testing to refute the concept of 2010 that Lyme disease doesn't exist in Australia, because we know it does. Clinically, this illness is here. The evidence that we're getting from overseas testing is showing positive. I've got patients responding very well to treatments, which are treatments for Lyme disease, but you can't refute this illness by saying just because the test isn't positive, therefore it doesn't exist. Unfortunately, the testing is what's the problem, is inadequate. We need more funding for research. We need more funding for actual treatment of this condition. But the first thing we need is a recognition this disorder exists in Australia by those most in power. Now there are infectious diseases specialists who I have enormous respect for. I'm not sure why there's a political agenda in actually saying this disease doesn't exist. Not all my patients come from Europe and America. They come from Australia. They've never left this shore. They have bullseye rashes from tick bites. They have positive PCR. They have positive antibodies. They respond to treatment. They have active Lyme disease. So either I'm seeing a different spectrum of patients or making a wrong diagnosis, or something's wrong with the system in the way we investigate it. My question is really to the practitioners out there, particularly infectious diseases doctors, to be a bit more open-minded about this disorder, as I believe we need more testing before we can say it doesn't exist. Historically, we know that ticks were introduced through the cattle that came to Australia, particularly from overseas in Asia and America, which could have by any means carried the ticks which carry these organisms. And I think there is a variety of Borrelia in Australia that's an Australian form. And because this is why we've got so many variable types of this disorder. We know that Babesia is here. We've had a recent death in Canberra of a man with Babesia. We see Bartonella. We know there's Mycoplasma and chlamydia pneumonia and Rickettsia from tick bites. So these other organisms we need to look for, but the nature of all these organisms is that they are stealth. They hide in the body, the immune response is inadequate, but the inflammatory response is major. So we're not dealing with an immune response which will be picked up by normal bacterial or testing or parasitic testing with antibodies or Western blot. That would be useful, but PCR testing, and we need to develop other tests to look for these organisms before we can even think about excluding this disease from Australia. My view is we have an epidemic that we're not aware of, and we need to strongly commit ourselves as a profession to actually finding this disease, diagnosing it and treating it appropriately, because I feel that a lot of the patients that have serious, particularly neurological Lyme disease, motor neurone disease, MS, may actually have Lyme disease. Now that's a travesty if that's the case, and they get treated as MS or motor neurone disease, which I realise is very difficult. There isn't any treatment, but they really have something that's treatable like Lyme disease. And currently I am undertaking treatment for a number of these patients. Many of them aren't very well, and I don't know whether they're going to survive because they've delayed 2 or 3 years before they've come here, and then I've tested them, primarily most of them overseas, and found they've had active Lyme disease because they gave a history of tick bite, became unwell, and developed what looked like other diseases. So my plea is, don't be closed-minded, open up research, we need funding, and we need a cooperative process, not an ambivalent one, and we definitely don't need conflict. I think the medical profession needs to join together, and with all the specialists and all that intelligence and capacity, to actually find answers for these patients that I see every day, that many of which have seen infectious diseases specialists and been abandoned or told they've got a mental illness, but really they've just got Lyme disease. So my view is that we need to be very careful about how we diagnose disorders in people where the diagnosis is not clear. We need to make a proper diagnosis, we need to follow it through, and we need to be absolutely sure before you label someone as having a mental disorder or a conversion reaction when really they've got an infection which can be treated. Look, I think the 3 things we need to do to have changes. The first is to have the medical profession stop keeping their head in the sand, but to come out and say, yes, this disorder exists. Now, there's a number of doctors involved in treatment of Lyme. We have a meeting this week in Sydney, and fortunately, as far as I know, the last time I spoke to the organisers, there was almost 100 doctors coming. Now that says something about a meeting on Lyme disease for a disease that doesn't exist, and 100 doctors are going to the meeting. There must be something in this to actually encourage those doctors, I assume they're mainly going to be GPs, to come to this meeting. But the other thing that's very important is for us as GPs and us people, the doctors treating these disorders, to tell our colleagues, to tell our infectious diseases specialists what we've found, and for all of us as doctors to document what we find, develop first-grade evidence, develop tests and help other practitioners to do the proper testing. That will give us some degree of evidence that's required to change the thinking. Then we need to encourage the governments to provide funding, or private bodies to provide funding for more consistent and thorough research into testing and doing double-blind studies of people, doing proper development of pathology tests, using some of the tests that are available overseas and using them here. And then we should be developing treatment protocols, special clinics for those who are disadvantaged and can't go to a private doctor, and start treating all these people which appear to be in the thousands with Lyme disease and hundreds of thousands with chronic fatigue syndrome who really actually have active infections. This head in the sand attitude will not get us anywhere. As a nation, we have a responsibility to those patients, but in a world stage, I don't know how many people around the world have chronic fatigue syndrome and Lyme disease, but my feeling when I go to the meetings, it's enormous. And the only way we're ever going to change the situation is to actually start thinking in a positive sense without this ignorant and narrow-minded view that these diseases are diseases of conversion, not necessarily diseases of infection.
Hello, Bec Mills here with Dr. Richard Schloeffel at the Pymble Grove Health Centre, and I just wanted to say thank you, Richard.
It's been a pleasure. I hope it gets somewhere.
And I hope that you can get home to your wife who's cooked you dinner.
Oh, thank you.
Peace out!